All right, welcome to the Let's Talk About Food podcast, where every Monday I do a deep dive on a GI topic to give you more information on what you can do to optimize your gut health. If you're new to this channel, my name is Dr. Islam. I'm a board-certified gastroenterologist trained at the Mayo Clinic. I have over 10 years of experience treating thousands of patients with all sorts of GI issues. If you like what you hear, if you like what you see, don't forget to smash that like button, like, share, and subscribe. And if you want to see me, come see us at Gastro, where I have my phone number and our webpage on our link down below. So we have a great show today. We're going to talk about a lot of things. We'll talk about some of the topics I've heard from patients today, including things that negatively affect your gut. We'll talk about this TikTok temporary fasting diet I've seen on TikTok, what that means and what you can take away from this. We'll discuss, can you get IBS or gut issues after some sort of gastroenteritis? Have you noticed if you have a gastroenteritis, has your gut started to not work as effectively as it did in the past? We'll discuss some of the signs and symptoms of an anal fissure, and we'll also discuss the 13 best herbs and spices I recommend when it comes to weight loss. And if you're watching on the live stream, we'll answer your questions live as well on today's video. So I hope you guys are having a great day today. So a couple of housekeeping things. So if you want to come see me at Lubbock Gastro, come see us. We take care of all sorts of GI issues. Wherever your food goes, I go, including your liver and your pancreas, gallbladder, stomach, colon, esophagus, and hemorrhoid issues as well. So I have a link down below. Our office is located on 4505 82nd Street, suite number 5 and 6, and our phone number is 806-696-4440. And if you're watching the live stream, let me know if you're on the comments you're watching this live or on the replay. And also let me know where you guys are watching this at as well. Hope you guys have a great week. Hope you guys are enjoying the Olympics, because I certainly am. I am an Olympic fanatic. Let's see, what did I watch this week? Obviously, I watched basketball. I watched hockey. I watched certainly the ice skating, the track. It's not hockey. I didn't watch hockey. There's no hockey going on in Summer Olympics. But I watched the swimming. We watched the gymnastics, pretty much everything. So I'm really excited about how the next couple of days are going to be when it comes to the Olympics. Hope you guys are watching that as well. Let me know in the comments down below if you are watching the Olympics, and also let me know, put a comment on their Olympics so I can know that you guys are watching this as well. So a common question I get, hey, Dr. Islam, what are some things that can destroy your gut and negatively affect your gut? So in today's first question, we'll do a deep dive on some of the things that can destroy your gut. We'll also discuss some of the symptoms or signs that you may come to realize that make you think that your gut may not be working correctly. Because if you have these signs, it may be worthwhile to avoid some of those triggers that we know make your gut a lot worse. So how do you know if your gut is out of whack? Now, there are a couple things that I look for. So there are certain digestive issues that you may be having. So things like bloating, gas, diarrhea, nausea, vomiting. If you've been diagnosed with IBS, if you've been diagnosed with dyspepsia or indigestion, if you've been diagnosed with acid reflux, these are GI symptoms that are common for those individuals and whose gut is out of whack. And sometimes getting down to the root cause of that can make you feel better. Number 2 is that if you have some stomach discomfort, feeling bloating or pain or cramping all the time, you don't know why you're having these issues, this could be a hypersensitivity going on inside your gut. It could be a sign that your gut is out of whack. Number 3, you're feeling tired all the time or fatigued. Now, we're all tired. Listen, I'm tired, you're tired, but this is unusual tiredness. This is feeling tired, despite getting adequate sleep. This is getting tired despite having good 8 hours. This is getting tired besides, having the good quality of sleep that you can have. And if you have this, that may be a sign also that you may be having something wrong going on inside your gut. If you start to notice food intolerances to certain foods that you did eat in the past or you are eating, cause you a lot of gut issues. Common ones include things like dairy or even gluten. And you start to notice this, that it could be a sign that your gut is out of whack. There are things outside the GI tract that could be a sign that your gut microbiome is not working. So your skin, for example, commonly acne, eczema, even psoriasis can be a sign or a symptom of your gut not working correctly. If you have also unintended weight changes, weight going up and down, you have fluctuating of weight, you can't really get a steady weight, or you're trying to lose weight and you're doing all your efforts that you can, and despite that, you're losing weight as well. If you also notice number 7, sleep disturbances. You're not sleeping effectively or efficiently. You go to sleep late or you wake up early, you wake up in the middle of the night, you don't have good quality sleep. This could also be a sign that your gut is not working correctly. You start to have mood issues that are not really explained. So anxiety, depression, things that are not normal for you, or you start to notice that things are not feeling good. This could also be a sign that your gut is not working correctly. If you have frequent infections like your poor immune system, you're always getting sick, you're always under the weather, there's always something wrong with you, this could be a sign that you're having a gut issue as well. And then lastly, number 10, sometimes malodorous breath can actually be a cause or a symptom of things going on inside your gut. Now, I gave you about 10 different signs or symptoms that could be an explanation of what's going on. They're not all comprehensive, and not all of them are due to what is going on in your gut, because sometimes a lot of these are multifactorial. However, there are about 10 things that I can recommend that we can try to change, so hopefully get your gut back on track. And so let me tell you what I would recommend to my patients if I saw somebody who came to see me who had these symptoms. So first thing is that we want to try and see if we can minimize the poor factors that can affect your diet. So having a poor diet can really destroy your gut. That's a diet that's high in processed foods, in sugars, in foods that you should not be eating. You know and I know what we should not be eating. I don't have to tell you this, but you also know that can be harder to eliminate those foods. And the more of those foods you incorporate into your diet, the worse it's going to be for you overall. And so minimizing those foods is going to make you better. Number 2, having a lack of fiber can also be a factor that negatively affects your gut. Fiber is the foundation for gut health. It really is. And without that foundation, you can't build on top of that. And if you don't have that foundation, you can't build a good gut microbiome and make things better for you. So you need to make sure you do that. Taking unnecessary antibiotics. Number 3, I actually had a patient who came to see me last week who took antibiotics for a viral infection, which you shouldn't. And she actually ended up having a condition called C. diff, or C. difficile diarrhea, which is a very, very bad diarrhea infection that can occur whenever you take antibiotics unnecessarily. And that can very commonly also affect your gut microbiome. In fact, I'll talk in this topic, develop or later on in the video, conditions or symptoms of a gastroenteritis, which can lead to long-term gut issues as well. Number 4, chronic stress. Now, we're all stressed. I'm stressed, you're stressed, we're all stressed. But chronic abnormal stress, not getting the capabilities of your body to rest and relax, this can also cause issues to occur when it comes to factors inhibiting your gut. So having that chronic stress can be bad for you as well. Poor sleep. Now, this does not only include length of sleep, but quality of sleep as well. How long you sleep and how much quality of sleep that you have absolutely affects your gut. In fact, this is one of the easiest things that you can alter to get your gut back on track. Number 6, alcohol consumption. I am not a fan of alcohol. In fact, I think alcohol is one of the more significant detriments to your health. And all the benefits that have been shown with alcohol have actually not been shown to be clinically relevant. So as much as you can, if you can minimize or eliminate alcohol, this can help you out. Number 7, having a sedentary lifestyle. So just sitting around. Our bodies are made to always be ambulating, to go, and to move around. If you're having gut issues and you're not moving around, make an effort every single day to find time to move around. Smoking. It's 2024. Why are you smoking? There is literally no benefits when it comes to smoking. It can harm your gut. It can harm your esophagus. It can harm your heart, your lungs, your pancreas, your liver, your spleen. Every organ is affected by smoking in a bad way. So you need to stop smoking if you are. Find ways to do it. Number 9 is being dehydrated. So much of our body is made up of water, and we need the water to hopefully allow us to live the life that we want to live. And if you don't have enough water, it can lead to a lot of GI issues, reflux, and constipation. Then lastly, if you have a known food intolerance and you have those foods, this can also make your gut symptoms a lot worse as well. So if you're able to find ways to figure that out, they'll help you out. If you minimize these factors that can destroy your gut, you can really change how you feel. You can change how your gut microbiome is, and you can get you feeling better as well. So let me know in the comments down below if you've noticed that this is an issue for you. Put it on the comments like if you're watching, or put in the comments gut if you're on the live stream, so I can see what you guys think. And also let me know in the comments down below, have you tried making these changes? Has it helped? And has it made a difference when it comes to your gut microbiome and how you feel as well? Because I can tell you that if you do this, these things will hopefully help out and hopefully get you feeling better as well. All right, topic number 2, this TikTok fasting diet. All right. I have been watching TikTok. I know. I try not to, but I have. And I've been seeing these reels on TikTok about people talking about this kind of fasting mimicking diet. Have you heard about this? Let me know in the comments down below if this is something you've heard about or you realize or seen. So in summary, let me see if I can find it here. This diet is a diet in which you're still consuming calories, but you actually consume only about 1,100 calories in day one, which most people need about 2,000 calories. Then you do 750 calories per day on days 2 through 5 while following a low protein, low sugar, high fat, plant-based diet. Now, the TikTokers say that this diet, this type of fasting diet, will help you to reduce bloating, make your skin glow, and help you to reset your gut microbiome. All right, this sounds magical. It sounds amazing. Like anything that's too good to be true, let's get down to the science of this. So, let me tell you, anytime someone tells me that I should do a diet, and then towards the end of the video, they want me to sell or to buy something from them, I automatically question what this recommendation is, because 9 times out of 10, if they are trying to sell you a supplement, a food plan, or something, you should be very wary about what type of diet or what they're trying to propose. I've seen this commonly on social media where people are telling you to do one thing, and then towards the very end, hey, buy my regimen, buy my supplement, buy this. And I just don't believe that. And so you can't do that. Number 2 is that fasting diets, there's not one size that fits all. So with this particular diet, you have to really be strict with the types of foods that you're eating. You're having prepackaged fasting mimicking foods that are low in calories, that are plant-based, and that sounds good, but you can't deviate beyond that. And so any diet that automatically puts you in a restrictive pattern, that automatically eliminates all sorts of foods and causes you to restrict as opposed to expanding your diet, is a diet that I do not want to do as well. Number 3 is that it's costly. It costs in this program, if you buy the program, $200 for 5 days of food. That is crazy. You don't need to spend that much money for 5 days of food. That is literally like, I don't know that. And it's through a company this guy has. And then the next is also very intense. Restricting your diet so much for that long a time, it's not good for you. Now, I'm all about fasting. I'll talk to you about it, towards the end. But doing this type of restricted diet is not good for you because it's so restrictive, it can be dangerous. What we have found with those individuals in which we try to put them on some sort of restricted diet is that it can lead to long-term consequences. They stay on the restricted diet longer. They actually start to develop more food phobias. They get scared of eating. They become obsessed with their diet and what they're putting in their mouths. And this can be very dangerous for a lot of my patients. And so I really worry when it comes to that about what people are trying to propose when it comes to that. And so let me tell you what I want to recommend for you. So I am a big fan of intermittent fasting. I do this all the time. I actually intermittent fast myself. I skip breakfast. I think this is safe. I think it's effective. And I think you should try and do this. Try and see if you can do this. So the easiest thing to do is to skip one meal. Whether you're skipping breakfast or dinner, find one meal and you skip it. And if you do this, I think you'll get a lot of benefits that you don't have to do with this particular fasting mimicking diet. So I am not a fan of this diet. I am a fan of intermittent fasting, but this particular diet, I would not recommend. I don't think it's going to be the best thing for you. I would not do it. I think it's bad for you. If you want to do any type of diet, the best diet may be for you to consider doing a diet that's intermittent fasting, where you can skip a breakfast, skip a dinner, and then eat kind of a little bit less throughout the day. It's what I do. It's what I'd recommend for my patients as well. All right. Next topic, let's react to a news. So I saw a news story that said that there was a new study that just came out which showed that there is a prevalence of gastroenteritis or a prevalence of developing gut issues after gastroenteritis. So let me know in the comments down below if you've noticed that after getting sick from some sort of infection, that all of a sudden your GI tract was out of whack. You all of a sudden started bloating, diarrhea, constipation, upset stomach, indigestion, things like that. And I have seen this in my practice, and we've seen this in the study. So if we look at the evidence on this research study, it's actually a pretty interesting study. It was done, and what it showed was that those individuals that had an acute infectious gastroenteritis that actually was a very common risk factor to developing a condition called irritable bowel syndrome, IBS, or even a condition called dyspepsia, which is kind of IBS of the upper GI tract. In fact, almost 40% of those individuals who had some sort of gastroenteritis actually ended up having a GI issue after their acute episode of gastroenteritis. That's a significant amount. Now, we've seen data to suggest this can be a particular problem that individuals do get. And if you've noticed, you can have these type of GI issues even 4 to 5 years after the initial episode of gastroenteritis. In fact, the studies have suggested in almost half of the patients, 50% for a follow-up after 4 years, still had GI issues after their acute gastroenteritis. So when I see somebody come to see me with gut issues like bloating or distension, one of the questions I do ask is, do you remember getting sick right before you had your GI issues? And a good number of patients can remember instantly the time they got sick, how they felt, and when it was. Because if it is the case, you actually may have post-infectious IBS or post-infectious dyspepsia. So what do we do for this? So number one, we want to confirm this. There may be some testing that we can do. But also number two, there are some medications we can give for our patients. So one of the more effective options is a medication called rifaximin. Rifaximin is an antibiotic that's released specifically in the small intestine or in the gut, which can change the gut microbiome to make it normal again. And for a lot of our patients, using this medication can actually change the gut microbiome to make it better and to reverse the damage that actually occurred with the gastroenteritis. Number two, we also recommend dietary changes. A low FODMAP diet with the help of a nutritionist can also be effective in managing the symptoms naturally. And so for some of these patients, I am going to recommend for you to see a nutritionist so we can find out what is going on and hopefully get a better idea of the next steps to hopefully get your GI tract taken care of. It's a very common problem that I see for a lot of my patients, a lot of patients that come to see me for GI issues. And so if you start to notice, hey, I did not feel good and my gut is not working correctly after an acute episode of infection, then you may want to come see someone like me to see exactly what is going on, to see if you have these post-infectious issues going on that may be explaining some of the symptoms that you're having as well. And if that's the case, obviously we help out with that because that's something that we deal with all the time in our GI life as well. All right, if you're watching the live stream, my name is Dr. Islam. I'm a board-certified gastroenterologist trained at the Mayo Clinic. Come see us at Gastro for all your GI needs. And if you're watching on the live stream, let me know if you're watching this, where you're watching it at, and also if which social media channel you're watching this at as well. And also let me know if you're watching this live or on the replay. Comment down below so I can hear that as well. All right, next topic. Let me get to it. Signs and symptoms of an anal fissure. All right, let's talk about this. So, what exactly is an anal fissure? It is literally a cut in your bottom. Exactly what it is. Your bottom does not like any type of paper cuts. It does not. And so even a small paper cut called a fissure can cause a lot of symptoms to occur, which we'll talk about in just a little bit. So why do you get an anal fissure? What are the reasons? Well, pregnancy. Very common reason. Sometimes you can get have that pressure in your bottom, and if you're pregnant, it can cause a tear. Number two is just having a large and hard stool. So constipation is probably the most common cause for a fissure. The bigger poo you have, the harder it's going to be for that poo to leave your rectum, and if it does, it may cause a tear down below to occur. Number three are also hemorrhoids. Hemorrhoids can predispose you to getting a tear in your bottom, and that can also cause a fissure to occur. So what are the symptoms of a tear? Well, I will tell you. You know what those symptoms are because it is a literal pain in the bottom. It absolutely is. So without being too graphic, it's like you're pooping shards of glass. It's severe pain in your rectum when you're having a bowel movement. And even a small paper cut can cause that because as you're having a bowel movement, that rectum muscle expands and it can cause that pain to occur. But not only that, it can cause bleeding to occur as well. So pain and bleeding are the most common symptoms of an anal fissure or a tear. So how do I know if you have a tear? Well, if you tell me the history, it hurts in the bottom when I poop, that will tell me you have a tear. But also number two, I can do a rectal exam, a digital rectal exam where I can actually take a feel, see where the tear is at, and confirm what my suspicion is. And also for these individuals, we also may want to consider recommending taking a look with the scope, because there are other things that can cause a tear besides a tear or those symptoms. Things like rectal cancer, colon cancer, and things, even ulcerative colitis can do that. So if you have a tear, what can you do? Well, so there's some natural things I always tell my patients. So number one, we got to keep your stool soft. Keeping your stool soft will make it easier for your stools to pass through, which will make it less irritating to that tear. Number two, increase your fiber content. Fiber is going to help out with your stools, help out with the bulk of the stools, and make it easier for you to go. Number three, consider a sitz bath. A sitz bath actually works, helps to kind of relax the muscles in the bottom and makes things easier for you. Number four, come see us because we can give you some creams to help out with that. We typically give either a nitroglycerin cream or a blood pressure cream to kind of relax that area. And the reason we do that is because every single time you have a bowel movement, your rectum will tense up, and that tensing up will cause that fissure to spasm and also cause that fissure to tear open as well. The more spasms you have in your bottom, the more tense it becomes, the more difficult it's going to be for us to heal up that tear. It's very common. And until we actually control that spasm and control that sensation, it's going to get worse and worse and worse. We give you creams to help relax that, to make it easier for you. But I tell my patients it can take some time. It can take between 4 to 8 weeks of continual use of the cream to make it easier. Sometimes on extreme cases, we do need surgery to kind of cut off that muscle to allow it to relax. But typically we want to try to avoid that if we can. So what should you do if you feel like you have a tear? Well, number one, don't ignore your symptoms, because those symptoms can be due to multiple other different reasons besides a tear. So make sure you see a GI doctor like me to see exactly what is going on, so we can pinpoint what could be causing that tear besides the tear itself. Number two, use a sitz bath. Number three, use some Miralax, use some fiber. And number four, come see someone like me where we can exactly see what's going on. If you have hemorrhoids, I can get those hemorrhoids fixed and taken care of, so we can get you feeling better as well. So if you're having any tear issues, come see us because we can find out what's going on and hopefully get you feeling better as well. All right. Once again, I'm Dr. Islam. I'm a board-certified gastroenterologist trained at the Mayo Clinic. I've been doing this for over 10 years. If you're new to this channel, I always do a live stream on Mondays, and I also repost this on my podcast as well. If you're watching the live stream, it's always at 6:30 p.m. Let me know if you're watching this live in the replay, and also where you guys are watching this at as well. Christina, good seeing you. Sally's good seeing you. Good luck on your endoscopy. Sharice, good seeing you as well. And Helena, thank you for watching on the live stream as well. Send me a like, send me a thumbs up. Let me know what you guys think as well. All right. Last topic, weight loss. Now, I know weight loss is all over the news, and it's easy if you want to try some of these GLP-1s to see if we can do that. However, if you're looking for a natural way to help out when it comes to weight loss, I'm going to give you 13 herbs and spices based on science that actually can help out when it comes to weight loss. And so if you want to try these, try them out. Now, I always worry when I give lists like this, like how people are going to take this. So what I would tell you is find some that you want to try and incorporate in your meals. And if you try that and you feel like it, go with that. You don't have to try them all. See what works for you. I've tried a couple myself, and I know which ones work for me in particular. So first one's fenugreek. I love fenugreek. It is fantastic. It is a natural herb that I recommend for a lot of my patients for lots of GI issues. It has very good anti-inflammatory effects. It has very good antimicrobial effects as well. It can help suppress the body's natural appetite so you don't feel as hungry as well. But it does have its own side effects, bloating, diarrhea, flatulence, things like that. But it is actually very effective. I actually have used this myself, and I thought it worked well for me. Next is black pepper. Black pepper contains piperine, and this actually can help out with boosting metabolism and also help out with carbohydrate regulation as well, because we know that carbohydrates are one of the biggest reasons why people gain weight. And so if you're able to minimize that, that's going to help out with your issues as well. Next is turmeric. I am a huge fan of turmeric. I use turmeric all the time, and I recommend this commonly to a lot of my patients when it comes to the gut issues. Turmeric has anti-inflammatory properties that can help fight out inflammation and stress, and is really good for your gut microbiome as well. Next is cinnamon. I love cinnamon. I add cinnamon to my coffee. Cinnamon can enhance leptin levels, which also can influence and regulate your appetite as well. Not only that, cinnamon also has its own anti-inflammatory components as well to support overall weight loss and your health as well. And so if you want to try and do it as a weight loss, the typical recommendation is about 3 grams per day when it comes to weight loss. Next is cumin. Cumin's also great, and I love cumin. Cumin, if you add about 3 grams of cumin daily to yogurt, there are studies to suggest that this can actually help out when it comes to cholesterol issues, LDL, triglycerides, and things like that. So if you like cumin, consider adding this to yogurt when it comes to weight loss. Next is oregano. I had no idea, but oregano also can help out when it comes to weight loss. It can help boost your metabolism and also decrease your risk for developing fat cell accumulation. It also has very effective antioxidant properties as well. Next is cardamom. I love cardamom as well. I actually add cardamom sometimes to my coffee to give it that nice flavor, that nice taste. Cardamom also contains phytochemicals in them, and these phytochemicals can also help lower your body weight as well and your body mass. Next is Carumula fimbritia. I can't ever say this right, but this is an herb that's been linked to suppressing your appetite. And so if you're wanting to try this, not a problem at all. I haven't tried it myself. Next, I always can't say this one as well. Gymnema sylvestre. I can't say this. It's Gymnema sylvestre. Now, this actual herb is a way to reduce the sweetness of foods and helps to reduce sugar cravings. So I have not used this myself, but if you are one of those, then you know that sugar is your trigger when it comes to weight gain, consider trying this supplement to help out. Next is ginger. You know I'm a fan of ginger. If you see my videos, you know this, but ginger is also very effective. It can help control weight loss, helps out with nausea, vomiting, and other issues when it comes to that as well. And then lastly are green coffee bean extracts. These also have their own antioxidant properties. They can help influence fat metabolism, help out when it comes to weight loss. So I know this is kind of a rundown of these herbs and spices, but if you found you want to try some of these, try them and see how you do. My recommendation is try it for about a week, see if it helps out, and see if you can hopefully make things better for you as well. All right, a question from the live stream. Any ideas to reduce tooting in inappropriate locations, such as a church? Well, you'd be surprised. This actually is a very common question I get from patients. How do we deal with farts? What do we need to do? Well, obviously, if you need to get out of the room, you can do that. So a couple things I recommend. So one of the more common reasons why people have farting is that they're constipated. You may not realize this, but you actually may be constipated. So even if you're going to the bathroom every single day, you could be having constipation. So what matters to me is not how often you go, but how do you feel? Do you feel like you've had good bowel movements? Do you feel complete evacuation? Because if you don't, I will tell you you're constipated. That's the first thing that we do. Number 2 is watch out with the foods that you're eating. There are certain foods that are known to cause gas. So for example, beans, high FODMAPs, apples, pears. I have a lot of videos on my channels about this. So if you have some of these foods you're ingesting, do that. Number 3, be proactive about what's going on. So you may need to take some medications like a Beano, for example, which can help reduce the gas content inside your gut. And then next, there are certain foods, certain drinks that can also cause a lot of gas to occur as well. So dairy products are a very common cause of gas down below. And then lastly, also, it may be the type of environment that you're in. So for example, if you're nervous, it will cause you to produce a lot of gas. So if you're in an area where you know that it's going to make you nervous, you may want to consider finding ways to deal with that anxiety better to minimize the gas that's coming through from the bottom. So these are my tips I recommend. Let me know in the comments down below if these tips are helpful or if you have any other recommendations for my patients as well. All right, guys. That's a great show we did today. A lot of good comments. Let me know in the comments down below if you guys have any more concerns or questions. If you like what you see, if you like what you hear, don't forget to give me a like button. Smash that like button. The social media giants love this. If you want to learn more information, come see us at Gastro for all your GI needs. And if you want to learn more information on what I'm talking about, tune in next week. Watch my YouTube channel, my Facebook channel, my Instagram, TikTok, and all my other social media videos. Look forward to seeing you guys on future videos. Hope you guys have a great and happy and safe day. Thanks and take care.